And if so, what adaptations are needed in order to enhance and support their use of vision? If not, how are we going to maximize access to other sensory channels? How is the student still going to participate with auditory or tactile or other means, kinesthetic means, or a combination of the two? Consider especially activities that involve high levels of complexity. Okay, or novelty. We talked a lot about complexity this morning. And if you think about your school day, you could probably just think of it right now. And if you have a student with CVI especially, think about all the things that happen throughout the school day and all the different environments that kids are in and all of the different materials that are presented to them. Which ones would you say involve a high level of multisensory complexity or novelty? Does anybody want to chime in? You can unmute. Can you think of an activity that really is very complex, multisensory complex? Something that's noisy, that has a lot of movement, a lot of activity, a lot of physical moving around, maybe?
The cafeteria.
Cafeteria. Absolutely. Absolutely. That's a really good example. Any other ones you're thinking of?
Someone said lunchroom.
Lunchroom. Mm-hmm.
Playground.
The playground. That's a really good one. Mm-hmm.
Arrival and dismissal.
Oh, absolutely. I'm glad that you said that, because often I think we skip over arrival and dismissal as critical parts of the school day. If you don't start off the school day well and you start off the school day overstimulated and really overwhelmed, it's going to affect everything else that happens after that. Yep. Anything else you can think of?
Someone said hall transitions.
Yep, hall transitions, absolutely. So a lot of these functional activities are coming up, right? A lot of sort of like, things that are not necessarily the academic activities, but that are, an important transitional part of the school day. Anything else that's coming to mind? How about the gym, right? The gym is pretty busy. Depending on what your school looks like, the PE class or APE class can be pretty multisensory busy. Other things you might not immediately go to and think of as that way, if you teach younger students and you have a morning circle, that tends to be a pretty busy activity. It often involves some moving around, maybe some physical warm-up stuff. It involves a lot of switching around from task to task. It involves alternating students talking and maybe presenting information in different ways. Students may be sitting in a circle around a rug, and that's a lot of complexity visually for the students to be attending to. So pick out those activities in particular and think of those as activities in which, for a lot of students with CVI, depending on what phase they're in, but really on into phase 3, it may be difficult for the student to use their vision in that activity, and you're going to have to decide, is vision a priority here, or is it okay for the student to just listen? We'll see how that's different from phase to phase. So let's really dig into each phase, and what we're going to do is sort of talk about each phase in terms of the general goals of intervention, what it looks like, some examples of intervention adaptations and modifications, including environmental ones, that might be helpful for a student in that phase. And then let's think about, what kind of would go into an IEP to support a student in that phase, and maybe what kind of role would the TVI play, and what would the TVI's work with that student look like? So phase 1 is the most severe impact on visual functioning, and it says most characteristics there. What it really means is probably all characteristics are impacting the student's visual functioning. Okay, so all of those characteristics we talked about this morning have an impact on the student's ability to use their vision throughout the day. The goal of phase 1 is just looking for the sake of looking at things. not for the sake of accessing functional information or participating in an academic routine. The goal is building visual behavior, so stabilizing the dorsal stream and just looking at things that are interesting. Because all of these characteristics impact visual access and visual behavior, there has to be a very high level of environmental control in order for a child in phase 1 to use their vision. Sometimes that means a dark, quiet room, not always. Sometimes it means that there can't be any other distraction at all, not always, depends on the student. But whatever it is, there has to be a high level of environmental control and reduced multisensory complexity. In phase 1, there is no visual processing of two-dimensional materials. Okay, and we know that because a child in phase 1 is not making eye-to-object contact. Remember, they're only using their dorsal stream. They're only getting information sort of peripherally and about movement and color and light and form. And so if they're not making eye-to-object contact, they're not directly fixating on things, it's not possible for them to be able to process and make sense of 2D information. That doesn't mean that they can't see the full object of a book. So in a read aloud, you're still reading books to kids, you're still showing them the book, but when they look at it, they're not looking at the 2D target. They're looking at kind of the rough form of the book. Maybe they're looking at a bright color on the page. And so picture the book, the Clifford the Red Dog books. That's a pretty good one for a child in phase 1, right? Because they're really not looking at the book. They're looking at this big red visual field on the page, and they may even be able to find it on the page, even though they're not looking right at it. They may still be able to locate that dog on the page because they're looking for a big red shape, okay? But that doesn't mean that they're processing the 2D and they're going to be able to find the eyes and the head and the tail and the ears or other objects on the page. We're still maximizing visual access throughout the day to different modes of communication and to different instructional materials. So we're still making the adaptations, but don't expect the child to visually fixate because they're not fixating in phase 1. What they're doing is visual regard. Okay, what you're looking for in that visual behavior, that visual skill, is just regarding or shifting towards something. And it's a deliberate, almost like a looking toward it or through it or past it, but not fixating. That's not happening yet. So if we're not able to visually fixate, and in some cases we're just not able to visually attend, especially in a busy classroom or say on the playground or something like that, then how are we going to access information? Through auditory, through tactile, some visual, but it's going to be very brief and it's not going to be very functional. It's just going to be sort of growing that visual skill. So in other words, kids in phase 1 are only using their vision in quiet spaces that have a high level of environmental control for the sake of looking at things that are interesting to them. So in order to make progress visually, we've got to plan times of day for addressing vision because we're not going to be able to address vision in the context of, academic activities or really even functional activities. It's going to be very hard to have a vision goal in any of those places that you mentioned earlier, in the cafeteria, on the playground, at arrival, at dismissal, during transitions. I wouldn't expect much vision at all during those activities, if any. So we still need times of the day to address visual goals. How much time per day? There's no set program, right? There's no rule as to what works or what's needed. It depends on the student. But if I had to roughly estimate, I would say that kids in phase 1, if you really want to keep stimulating their brain development and, their visual processing, you want at least a handful of times a day. So for how long though? Probably not more than, 15 minutes at a time, because 15 minutes of visual activity is that's your window and that's it. Some kids need a little bit of a warm up though. So some kids may need a 5-10 minute warm up, then you get 5 solid minutes of vision, and then, that's kind of it. It could mean pulling the student out to a separate location, like a room, a dark room, or a room that has more control and not as much around there. It could mean creating a space like an activity station in the classroom if it's not too loud. What are the best times of day for this? Downtime for sure. Any time that otherwise would be relative downtime. Maybe in between activities is a good time to do this. Maybe if a student doesn't need to be there for the entirety of a certain lesson, but you want them there for part of it, maybe you're going to pull them out, do a little 15-minute vision thing, and then back to the activity to join in with the other students. Related service providers and therapists. Okay, if you're a speech pathologist, OT, PT, certainly vision, you might integrate these kinds of things into what you're already doing. And again, I'm not asking an OT, a PT, or a speech pathologist to suddenly become a TVI. It's not that. It's that vision activities, and we'll see some examples, may be very helpful as warm-ups for the goals that you're focusing on for speech, for OT, for PT, and so on. Right? Different roles can kind of take different approaches to this. If you're a gym teacher, art teacher, music teacher, whatever, you may find ways to integrate little 5-10 minute segments of this as warm-ups to your activity. Okay. And you may find that that actually supports and enhances your activity. Okay, so some concrete ideas. A lava lamp. If you think of a lava lamp, aside from the fact that it's, you know, the traditional ones are super hot and so not safe for a school environment, but a lava lamp is a good example of something that has all of the characteristics that are needed for a phase 1 intervention. Use it in a dim environment. It has a bright, colorful light, right? So you've got light, you have color, and you have movement because there's a moving feature to it. I know that there's all kinds of different materials like this that you have in your sensory rooms, or if you have like a Snozellen room, like a multi-sensory, you know, like sensory regulation room or something like that. Just be cautious of having too many of those things around. Kids in phase 1 are really only looking at one thing at a time. So having a whole bunch of different light up toys and different sensory, you know, things around is going to be overload. That's going to be multi-sensory complexity. Things like this, like, you know, the bright reflective wind tunnels, or like, you know, mylar balloons and things like that. Flashlights are critical in phase 1 to illuminate an object. Okay, so the student's not seeing the object, they're not seeing the object, and then you shine a flashlight on it and you get a visual orientation. Some kids, this is really, really important. Some kids, it's not as important, but it still may make an impact in certain settings and with certain materials. And this is something that continues on, you know, well into phase 2 sometimes, most of the time. Lighting, if you're going to use any of these kinds of like, you know, Christmas lights or anything like that, try to find ones that don't have that are like with the tubing, as opposed to just the individual, you know, Christmas lights, because even if they're all the same color, it's very complex. With the tubing, it's less complex. It's just like one solid light. But you can see here in this picture on the bottom right of this tubing, you know, tubed red Christmas lights, they still have those little hot spots where the bulbs are. They do make LED lights that you can get the full strand and there's no hot spots on it. It's just one long strand of light. You can wrap that around something. People have all kinds of interesting ideas for phase 1 intervention. As you can see, it's not the most functional looking intervention. It kind of looks like just vision stim stuff, you know, stuff to just stimulate vision. And that's exactly what it is. I find that teachers, especially TVIs, working with kids in phase 1, find it hard to do this kind of work sometimes because you don't feel like you're doing your job as a TVI. You feel like, what is the purpose of my job here? You know, sitting in a dark room, waving a glow stick around at a student for, you know, 10 minutes, 20 minutes, and you don't feel like you're doing anything super educational. Okay. But that is exactly what a student in phase one needs, because the visual goal, remember, is just building stable visual behaviors, learning to look at things that are interesting and easy to look at. Okay, and then it's getting stronger. That skill is getting stronger neurologically. And before you know it, the student has made some progress and is now able to look at more things. And then they're on into phase two, which has a very different purpose of intervention. This was a pretty cool example. There's a photo here, and what you see in the photo, there's a little girl, and we're viewing from behind. There's a little girl with a head switch on her right side. She's in an adaptive chair. So when she hits this head switch, the head switch is connected to a fan, and the fan is blowing air onto a gold pom-pom that's taped to the wall to her left side in her preferred visual field. And there's also a black board in front of her to sort of block off any background complexity that might be distracting in front of her. This is a pretty awesome example of a student-driven, switch activated phase one CVI intervention. Again, it's not a babysitting device. It's not for the purpose of just put the student over here and then, let them do their thing as like a free time activity. It's a controlled visual intervention. And so you want to be right there with the student, kind of checking out what's going on and observing and monitoring their progress. And it's not that we want to leave the student in this position with this item, for a half an hour. This is probably like a 5 to 10, maybe 15 minute at the most, little kind of in-between activity, a downtime activity. But it's a nice way to support also developing self-determination and cause and effect. Think about the little room or active learning, if you know about that. The idea that kids learn better when they learn actively, based on their own exploration and their own activation, as opposed to just having things given to them or put in front of them in a passive way. Okay, so this is a nice example of like an active learning adaptation for a student with CVI in phase one. Okay, what do we do about the busy classroom? We've got that photo again here, or maybe this is a different photo of a preschool classroom shelf. There's a very bright window behind it, but there's also a preschool classroom shelf that's very, very busy. It's got dozens of multicolored, sensory toys and items and baskets, and it's very, very visually busy. You don't need to get rid of your amazing materials in your busy classroom. There are different choices about what you could do with it. One thing is you could get just a black cloth to hang over that for whenever you want the student to be facing that way. You also probably want to pull the shades on that window, because that bright light is going to be impossible for the student to focus on anything. Or you could keep everything just as it is and make sure that there is a different station in the classroom. This is the exact same classroom, but the opposite side of the wall. On the top right now, you see a nice clean space with some black paper against the wall, and two little desks with a light box set up. There's no visual clutter there. It's just a nice controlled setting. So you could create activity stations for visual focus activities where the student has their back to the busy or brightly lit areas. Again, that picture that we saw earlier of the student with looking in the mirror with the black trifold board behind him, nice example of this is probably like a early phase two, late phase one, early phase two intervention where we're supporting kind of that black background. And again, the use of a flashlight to illuminate a visual target tends to work better if the lighting is dim, right? This was a pretty cool one in a very busy classroom, a very busy preschool classroom in New York City, where there really was not very much space in the school to do any kind of vision activities or to pull the student out. So the team got one of these little foldable sound walls, and it's like a little foldable unit. You can get those from educational material catalogs like Lakeshore or something like that. And the idea is that the sound wall reduces the background noise, but it also creates a quiet visual space too. And the student is inside of that space with the teacher in this little controlled vision activity, and the rest of the busy room is blocked off. Okay, almost like a little tent that you created for that student to do some vision activities inside of, if you can't get out of the busy classroom and you don't have the space. I'll show you a little app, and this is a short little video. This is an iPad app called the Cause and Effect Sensory Lightbox that I really like for kids in, phase 1. And I'm going to open up this video and I'll just tell you what you're watching. Okay. All right. So this is a little girl who's in phase 1, and she's probably, I think she's only about 2 or so at the time of this, and she is leaning against this sort of like pillow tumble form to kind of help with her visual field. She has a left visual field preference, and with her left visual field, you're going to see her sort of looking towards this iPad screen with its bright purple, and she's holding on to an Apple Pencil, right? A little stylus. And when it presses against the screen, it creates this bright light and this sort of movement and wave of color. Okay. And the teacher is taking a very nice kind of hands-off approach. He doesn't have his hands tactily or physically touching her. Instead, he's controlling the movement by holding onto the end of the pen. And what you're seeing here is you're seeing how a student in phase 1 may look only very, very, very briefly, and then is going to look away. But you can see the kind of adaptation or intervention that's useful for a student in phase 1. Okay, I'm just going to pause it there because you kind of get the idea. But I think what's important to think about here is just what a patient kind of activity this needs to be with no verbal input. You're not talking to the student, you're not prompting them, you're not touching them if you can avoid it. And you're allowing the student a lot of time to look away, look away. Anything that we're trying to do to get them to look is not from verbal or physical prompting. It's from visual prompting. See, once you get that movement, then she can look back down at it. So it requires a decent amount of patience. It also requires some careful looking and monitoring and observing about what exactly is going on and what's the student looking at or not looking at. Okay. And this app is pretty cool because you can choose different backgrounds. I think it's either free or like 99 cents. Okay, now in phase 1, because vision is not going to be possible to access throughout the day, only at targeted points of the day when we're doing visual focus, we're going to need some tactile adaptations. We may need tactile adaptations into phase 2 as well, but we definitely are going to need them in phase 1. That doesn't mean that we're focusing on Braille or pre-Braille, right? That would be a very rare situation where we're recommending Braille for a student with CVI. That would be if we're not expecting, progress in visual functioning, which really isn't happening unless the student has like a degenerative neurological condition, or isn't making progress because of some other ocular visual impairment. So it's not that we're focusing on Braille, it's that we're supporting visual adaptations with some tactile things on top of it so that the student is still able to access them even without their consistent use of vision. So on the screen right now, I just have 4 images showing different examples of tactile materials, and there are, hundreds and hundreds of other ones that you might think of and use. But a couple that I really like are American Printing House for the Blind, up on the top left. I think this is like the tactile carousel or something is what it's called, but it's like a whole bunch of, assorted tactile materials, and including ones that are visually interesting too. So that's the idea, is that anything that's tactile, you also want it to be visually very interesting at the same time. Wiki sticks up on the top right, I'm sure everyone is familiar with those. Those are pretty good. Just try to use the bright colors if you're using them, right? Try to use bright yellow, bright orange, bright red, and so on, whatever the preferred colors of that student are. Now on the bottom left side, you see some examples of tactile name tags that have different textures on them, that are used to label different students' lockers. And there are a couple of them you can see on the different, on the lockers. So the student with CVI can go along and feel to find their locker, but there's also something visually interesting about it too, whether it's a bright colored background or a bright colored, texture. On the bottom right, the American Printing House for the Blind, also you can get from them this quick draw paper. It's called quick draw paper. And it's basically like that dehydrated sponge paper. Like when you get those dehydrated sponges where when you soak them in water, they expand. Well, this is like a 8x11 sheets of that type of paper that if you dunked it in water, it'd become a giant sponge. But if you take a wet wash marker and draw on top of it, it raises up the surface of the sponge. So it's a good sort of pre-writing or early drawing activity for a student with CVI if you use a brightly colored marker, because you're going to get a visual input and you're also going to get a tactile input that they can feel. Okay, so this is the way you want to be thinking about tactile adaptations. Make sure that they also have a visual component. So here's just a short list of accommodations that might be helpful on the IEP for students in phase 1. It's not comprehensive, and it's not that every child in phase 1 needs all of these, but these are ones that tend to be helpful for kids in phase 1. Black trifold boards, black sheets, or a black table covering to block out busy visual information, quiet environment whenever vision's expected, not all the time, but whenever vision's expected. A stable supported position, okay, not being held, okay. I want to make a real important point here. Positioning is so important to students being able to use their vision, like we saw with the Riften chair, different positions that you're in. But also if you have a young child with CVI and they're sitting on someone's lap, that adds to the complexity, being held onto, being tactily interacted with or touched. So the student's vision is going to go down. It's going to be reduced when they're in positioning that, involves tactile contact and input and being moved around a bit. Definitely positioning facing away from light sources. Also things like a spotlight or a flashlight to illuminate objects. You might also want to put there on the IEP that not to expect visual attention during functional or academic activities, to reinforce the fact that that vision or looking is a totally separate activity. So maybe you're also going to put planned times of day to use vision. Now, some suggestions for the role of the TVI in phase 1. In phase 1, you're probably, if you're a TVI, you're probably going to want to pull the student out into a controlled environment. Pushing into the classroom probably is not going to be as helpful in phase 1, unless it's to go to a controlled environment or an activity station inside the classroom. But in order to help the team, you also want to help the team identify times of day when they can do additional intervention. And you want to help them identify materials that might be helpful for the student to look at during that downtime. You also might want to help the team, whoever, the PT, the speech, the classroom teacher, the gym teacher, to find ways to have more environmental control or set up separate spaces within their settings for vision activities. I'll share some sample goals. We don't need to necessarily go through these one at a time because I want to make sure we have plenty of time for other things. But I wanted to have these there for you as examples of IEP goals that might be helpful or functional for a student in each phase. So I'm not going to read through those, but you have access to the presentation. I will, if you don't already, I will share it with you as a PDF so that you can have any of these resources that you want. Okay. Any questions about phase one? I think phase one is a little bit more straightforward because the bottom line is that in phase one, the student's not using their vision outside of those structured, controlled vision activities. Okay, feel free to interrupt if you have questions. Phase two, the goal is integrating vision and function. What that means is that in phase two, kids are able to use vision in activities, but only if they have the right adaptations and the opportunity to look at those adaptations. Not true of a child in phase one, right? A child in phase one, even if you add some adaptations to an activity, like a reading activity or a mealtime activity or the gym or the playground, cafeteria, this child in phase one is still not going to use their vision, even if you have those interventions in place during the activity, while other stuff is happening, while you're expecting them to listen or touch or interact. A child in phase two is able to use their vision, but only if you have those opportunities. There's a major difference between early and late phase two. And the major difference is early phase two, there is no eye to object contact. In early phase two, it's just regard, right? There's no looking directly at or fixating. In later phase two, there's fixation. There's direct eye to object contact. And so the real difference there is that the level of adaptation that's needed, kids in later phase two are using their vision more throughout the day. And so you actually need to adapt more because it's even as the student's vision improves, now they're using their vision more. So they're looking at more things and more things are going to have to be adapted. So there's another misconception about CVI that as the student improves, the need for adaptation reduces. In CVI, it actually tends to be the opposite. The other big difference is that, remember, if you're making eye to object contact, like in later phase two, you begin to have access to looking at 2D materials. Kids in early phase two have no access to that. So the question you want to be asking yourself in phase two is, what do I need to adapt in order to elicit and sustain or to gain the student's visual attention at specific or targeted points in the routine, not for the whole routine. So imagine now a morning circle activity for a child in phase two. You're not expecting that the student is going to be using their vision constantly for the entire half hour or 45 minutes. Instead, you're picking specific points in the routine where you want them to use their vision, and you're selecting items that you want them to look at and figuring out, what do I need to do to this object, or what do I need to do to this display on the smartboard in order to get the student to look? So that's where the CVI schedule and other planning tools come in, which we're going to talk about briefly. Okay, so in phase two, it's all about planning that vision component, right? We've picked a routine, take any activity, and we're doing the same kinds of things that we would do in phase one, but now we're applying them to activities. So it's still about color, it's still about light, it's still about movement, it's still about visual complexity and visual novelty and visual fields, okay? But now we're applying it to functional routines and academic routines. So somebody had said, arrival in the morning. That's a very busy time of day. There's a lot going on. A child in phase one is not using their vision at arrival routine. It's just not happening. So if your student is using their vision at all during arrival, then they're not in phase one. A child in phase one looks almost like a student who's totally blind in that activity. A student in phase two can use their vision, but only if they have the right adaptations to anchor their visual attention to the important aspects of the routine. So one way to think about this is to separate the routine out to beginning, middle, and end. Okay, just those three parts of the activity. And let's pick one thing to look at in each part. Okay, again, not the whole activity. We're not expecting the student is using their vision all throughout. We're picking a beginning, a middle, and end target to look at. So at the beginning, think about the goal of the beginning of arrival routine. The first thing is really just to find the classroom. So in order to find the classroom, we're going to have a little bit of red tape around the door tag of the classroom. And so when the student's walking down the hallway, they can find that bright red tape, just like on the light switch that I showed you earlier. Now, in the middle of the routine, the goal is to find your locker. The locker area is another area of the school day and of the classroom that is extremely busy, right? And think about, your cubby, your arrival, your locker routine. It's always like, especially if you have elementary school students, there's just stuff all over the place. There's, backpacks and jackets, and, there's stuff on the floor and so on. It's not going to be possible for that student in phase 2 to really explore visually for the entire thing, but maybe they could just find their own locker if it's very brightly highlighted. Same idea as the light switch. So maybe the student's name in large print on cardstock, bubbled in red, or maybe even just a bright red tag above their locker. Almost think of it like a big arrow that's pointing at their locker and letting them know where it is amongst that busy array. The end of the routine is finding your chair and sitting down, getting ready for the school day. So same thing, just can you have a bright visual target that helps the student find their chair? Maybe it's even the same one, like a name tag that they have on their locker. Okay. So this is just an idea of how to do that. It's sort of like a task analysis, right? Some students, if they're a little further in phase 2, they can handle more than 3 things. Maybe you're picking 5 things that they're going to look at in that routine. Some students at the very beginning of phase 1, maybe we're just going to find one thing to look at. So this is just a rough idea for looking. So some intervention ideas, some concrete examples for you. Remember that picture of a student earlier who was using non-purposeful gaze, or she was light gazing because she was being spoon-fed? Well, maybe if she just had a bright target at the end of the spoon, a bright red, reflective target, like you see in this picture, maybe she would be able to use her vision during that activity. And it's not necessarily that the spoon has to be red. It's more that we're using our vision in that activity. So what they have there is, there's a child who is, sitting during a mealtime routine. You see the hand holding the spoon, about to feed him. And at the end of the spoon, there is I guess that's like a pipe cleaner, a red pipe cleaner that's curved up and has a bright red reflective heart at the end of it. Super easy to see, and the student is using their vision in that activity now. Or it could be that the object itself you want to be a bright color, like a bright yellow toothbrush. Now think back to my activity or my simulation with the mug. So if you're trying to get your student to find their toothbrush at the sink, maybe you want to have a bright yellow toothbrush with nothing else around it, right? Just in that mug by itself. Whereas if you have other things there, or if you have a toothbrush that's not a bright color, it's not going to pop out. It's not going to stand out. As I gave the example before, you might be thinking about, in the lower visual field for mealtime, very hard to get that information. So you might want the student's bowl to be a bright color, like a bright red or bright yellow. A name tag doesn't have to necessarily be about the student reading their name. It can just be about finding their location, their locker, their name for morning meeting or morning circle, their chair, their desk, or whatever. Can you have a bright, saturated, and reflective name tag that helps them to locate where their area is? Okay, sometimes just containing things into smaller spaces. Like there's a picture on the bottom left there of a little boy looking at this bright orange kind of like cush ball. And it's much easier to look at it if it's in a bucket, like a bin. I had a student with CVI who always kind of took her shoes off when she got to class. She had some sensory issues and she needed to take her shoes off. And we wanted to get her to at least put her shoes away in a bin and then to retrieve them when it was time to leave the classroom and go for a walk or go down the hallway. So we got a bright yellow bin for her to be able to put her shoes in, and that was very easy for her to access and reach for and put her shoes into. Same thing with communication symbols or cards. Can you get, a brightly colored and uniquely colored finished box to be able to put symbols into? It's in phase 2, right, that we start to see the use of a light box for more functional or academic purposes, like looking at letters. And on the bottom right, you've got a picture of a little girl looking at the letter M, just a little paper cutout printing placed on a light box. Okay. The light switch, the red tape around the light switch is a perfect example of a phase 2 intervention. It's a visual landmark. That wouldn't be helpful for a child in phase 1 because a child in phase 1 can't look around and find that. It's perfect for a child in phase 2. On the right side, you see a picture of a shelf with popcorn on it. On each shelf of this piece of furniture, there's popcorn on it. And then on the top shelf, there is a bright yellow outline, looks like they cut out some cardboard basically to outline the shape of the shelf. That's the top shelf. Similar idea to the light switch. This was for a classroom with a slightly older students who were in a pre-vocational setting, and they had one of their classroom jobs was to deliver snacks to the rest of the school. So the student with CVI in phase 2 could know where to get the snacks that he needed to deliver from even further away, from 5-6 feet away. He could see that bright yellow outline that helped draw his attention to that area of the classroom and to those materials. Okay, now with the locker routine, the arrival to school, I'm showing a picture with an example of bright yellow tape, just electrical tape, outlining the bottom rim of a student's cubby. And you can also see that her name is on her name tag above the hook is also a bright color, and there's even a little bit of yellow tape around the hook for her to be able to figure out where to hang her bag. Whereas without that adaptation, she would be overstimulated and overwhelmed by the complexity of that area of the classroom, and she wouldn't be able to figure out where is my space, where's my cubby. Paths to Literacy, which I mentioned before, is an excellent resource in general for getting ideas. They have some really great posts specific to CVI, and here's a cool example that a parent had posted of a sequence board for a student in late phase 2. You know it's late phase 2 because there's 2D images, right? It's basically a black tray, one of those black rimmed trays you can get from APH. The black tray has a little green sticker on the left side and a red sticker on the right side, right, for first and then or now and later. It also has yellow tape in 2 sections, 2 rectangle sections, to be able to put these photo symbols on top of. And below it, you can see examples of the photo symbols. And if you had to describe those are photographs, color photographs of real objects that the student knows, cut out, placed against a yellow piece of paper, then cut out again so that the yellow is just an outline around it, and placed on a black piece of paper so that we have real photos of color items against a black piece of paper with a yellow highlight or a yellow outline around it. The purpose of the black paper, of course, is to reduce the visual complexity. The purpose of the yellow outline is to make the symbol really pop out. And that should always be in our mind for kids with CVI, what can we do to the target or to the environment to make the desired thing that we want them to look at really pop out, really stand out against a background? This is a really nice example of that. Okay, another idea to be able to help a student with CVI search or find things against a complex array, like in a picture book that has, lots of different complex cartoon images and stuff, and you don't know, the student is having trouble figuring out where to look, just like with Where's Waldo earlier, is to take, and I'm holding one up right now, like a window. Basically, get a stick or a popsicle stick, and at the end of it, cut out a window. It helps if the window is a bright color. Red is a good go-to, but again, individualized for your student. This is like a shiny reflective paper that I'm holding up. And I cut out this window so that it's easy to search against a complex background. If I'm looking in a book, if I'm showing you something on a page. This is also super useful for kids with AAC programs with, like an iPad or a Dynavox or something, and you want to then make the window the same size as the icon on the display. What I find this super helpful for also is to support a student to model visual scanning. So you can start on the top left of the page and you can show them what you want them to be doing visually with their eyes. This is so much more effective than trying to take a pointer and point out something, let alone take your fingers to point something. So again, a visual adaptation, a visual cue, rather than a verbal or a physical cue. So if a student's not looking and not searching, support them to do that visually, not verbally or physically. And I've actually found that this type of window is super helpful for a lot of kids, not just kids with CVI. I've definitely had some like aha moments with teams lately, just pulling this out and trying it out with them. You want to have it cut out in the middle so that the student can touch anything in the middle of it, right? And I would call that a window, not an occluder. An occluder blocks off the entire background and just has a little space in the middle, whereas a window is exactly that, right? It's just the rectangle or the square or the shape. Okay. So some ideas for accommodations for kids in phase 2 that could go onto the IEP. Carefully selected objects, limited combinations of color, and reduced complexity of the array. Okay, something you might consider putting on a student's IEP. You're still controlling the background, but it's not that you have to control the entire environment. You don't need the entire classroom or the entire setting to be different. You just want to control the background of what's presented to the student. Also, still reduce the background noise. You got to control some of that auditory background. Positioning is still important. The student's placement in the room, for example, with their back to the window or their back to the busy, cluttered area when we're expecting focus on vision. Here's an example of intervention planning in phase 2. And you can tell it's phase 2 because of the type of approach for a hand washing routine. Similar to our planning with beginning, middle, and end of the activity. Basically, think about the task analysis or the procedure. What happens in a hand washing routine? The student has to find the bathroom, they go to the sink, they find the sink, they turn on the water, they wet their hands, they find the soap, they reach for the soap, they apply the soap, they lather their hands, they rinse their hands, they find the towel, they take the towel, they use the towel to dry their hands, and they put the towel away. Okay, that's, if you had to break it down to all of the individual, steps, we're not expecting the student with CVI to use their vision throughout that whole activity. Just like what we talked about earlier with the gym, with the cafeteria, etc., there's parts of every activity that are very complex. Okay, like lathering your hands. Okay, using the towel to dry your hands. Those are 2 times where I'm probably expecting that the student's going to be looking away. He's going to be focusing so hard on the physical task that he's not going to be able to use his vision at that time. That's okay. So instead, maybe we're going to pick a couple of things for the student to look at, simple adaptations and opportunities to look at those things that are not during those most busy times. So for finding the bathroom, bright tape or mylar on the edge of the bathroom doorway. For finding the soap, just the dispenser is going to be a bright green color. And for finding the towel, it's going to be a bright yellow towel. So it's simple as that. Those might not sound like important adaptations or, to go onto an IEP, but it makes the difference between the student using their vision or not using their vision. Okay, if you have these adaptations, you're supporting the student to use their vision. If you don't, you'll just see the student go through the whole activity looking up or at the ceiling lights. Okay, it could be for finding the paper towels too. We're gonna shine the light on the towel dispenser or something like that. Okay. So IEP planning, one of the ways to think about doing this is the IFSP or IEP planning worksheet, which is basically a template that helps you to figure out how the student's CVI is going to be accounted for and adapted for in the IEP itself. And this is something you can find in the textbook by Dr. Roman. But basically, it includes, information about the student, description of how the characteristics impact the student's vision, description of characteristics that don't impact their vision, what are the most important ones. We're going to focus on the CVI schedule in a minute, and we also want to identify any activities that are not targeted for vision. We're going to say, well, gym is just too crazy of an activity. That's not something that we're going to focus on vision. Instead, we're going to focus on vision at these other times. Okay. So an example of a CVI schedule, if you haven't heard of it before, a CVI schedule is basically a plan of the day going across the activities that the student engages in. And they don't have to be in time sequence. It can just be a list of the various activities that the student does, how CVI impacts those activities, and then very simply, what CVI adaptations we're using to address that. So take the hand washing routine or the locker routine and put it together in a plan that looks at the whole day. Now, what you do not want, and I've seen it many times, you do not want a CVI schedule to become an overwhelmingly long document. And I've seen this many times, a 25, 30-page CVI schedule, that's not helpful to anyone. Okay, that's overwhelming and nobody ends up using it. You want the CVI schedule to be super straightforward and simple. And if you have adaptations that are repeated a lot, it's like, well, use the flashlight in every single activity to show, the student interesting information. Then just put that separately on a part of the page that says, strategies for all activities. Don't repeat it over and over and over again, because that's how this thing gets too long and too unwieldy and people don't end up using it. The other tip that I'll give you for creating a CVI schedule is do it as a team. This is not the responsibility of the TVI alone. The TVI can guide it, but everyone on the team's got to be involved, because there should be interventions for each activity. There should be interventions for OT, and the TVI can't design that. And it's not helpful for the TVI to design that. The TVI can work with the OT in order to figure out, okay, so in OT, what are the things that you want the student to be able to look at? Okay, we've got a couple, 3 or 4 things, so let's figure out what we need those items to look like or to feel like in order for the student to get access to them. It's another just example of a CVI range, CVI schedule. Here's a little tool which I can share with you as well that just helps for team planning. This is just like a conversation piece to help you be thinking about these things and planning activities. So don't feel overwhelmed that you have to do the whole CVI schedule at once. Instead, take one activity, figure out what the targeted area or goal of that activity is, and break it down into the steps that happen in the beginning, the middle, and the end. How does CVI impact access to those steps? And then finally, what are the adaptations, accommodations, and modifications that we're recommending to access that activity. And remember, it's not just about material adaptations, it's also about the environment. Okay, so there's a very interesting thing, new development in the field, especially by Dr. Roman and a TVI from Connecticut named Matt Tejan, you may have heard of, which looks at sensory access and sensory balance planning. The idea is that kids with CVI may need to have their visual demands limited when they're focusing on other things like auditory or tactile, and vice versa. When a student's focusing visually, they may need to have the auditory or tactile input limited. So how do we find a balance for that, right? And how do we plan that deliberately throughout the day? I'll share with you briefly. I had a student in mid-phase two, student in mid-phase two, who's starting to learn some sight words and some has letter recognition and sight, but it's very, very hard because he can really only be able to attend to that very briefly, and he's still having trouble understanding, processing visually to differentiate and identify and recognize individual sight words and to visually discriminate them. But that student's comprehension is close to grade level. So he's a fourth grader. He's able to listen to a story and respond to comprehension questions at grade level, but his decoding, his actual reading skills are more like on the kindergarten or first grade level, right? So we have to balance his day and balance his ELA schedule, his English language arts schedule, almost by breaking those two activities in two. So sight word instruction is in short, intense intervals, and it's only visual, and there's no auditory demands at all. We're talking to him still, but when we're giving him time to look at the word and try to figure it out, we're not talking at all, right? And we're not touching him at that time. We're making sure he's in good positioning, where we have black backgrounds. We have all of these more environmental controls when he's focusing on that very visually taxing activity. But reading comprehension is the opposite. Reading comprehension, we want him only to be listening with no visual demands. It doesn't mean that we have to blindfold him, but what we don't want to do is require him to look at something while he's supposed to be listening. And I found this out because I went in and observed the team. They had him looking at an iPad with the Bookshare app, and he was supposed to be listening along while he followed the Bookshare app in large print, and it had the setting where it has a little yellow highlighter that goes over each word that's being read aloud. And he was struggling really hard to follow. He was trying to follow and find where that highlight was to be able to attend to the read aloud. And what happened was he was working so hard visually that he lost all the comprehension. And he actually his comprehension scores were going way down. But we found that if we just close that laptop or turn off that iPad and it's just listening, don't worry, you don't have to look at anything, just listen and focus on listening, then his comprehension was at grade level. So this is a great example of sensory balance, right? But it does require some planning because we have to look throughout the day at what are the visually taxing activities and what are the activities where we need no vision. Perkins just came out with this publication. It's 30 pages long or something. It's like a little booklet, which is basically an assessment approach to learning media planning, almost like a learning media assessment for kids with CVI. And what it does, it helps you look at which sensory channels to use in each activity, whether it's visual, auditory, tactile, or kinesthetic, and identify, which you could do on your own too, identify first what are the most visually taxing activities throughout the day. And for that student, sight word decoding was it. And he couldn't do that for more than 10-15 minutes at a time because it was so overstimulating. And for those visual activities, what accommodations and adaptations are needed. Versus when are we not requiring vision? When are we just using auditory or tactile means? What you're seeing on the screen now is a picture of a cat who looks freaked out with a little flower on his head. And this is to illustrate the point that if you're observing students closely, if you're really paying attention, you're going to be able to tell when they're overstimulated. Kids show that they're overstimulated. Don't misinterpret behaviors, even tantrums and meltdowns. They can and usually are caused by visual and sensory overstimulation by kids with CVI. Okay, so that doesn't necessarily excuse the behavior if it's a maladaptive or aggressive behavior, but it does have origins in multisensory overstimulation. This is what happens when kids get burnt out and overstimulated. In order to help moderate that, Matt Tejan designed what's called the What's Complexity framework, and he teaches a whole class on this through Perkins e-learning. The idea is balancing the activity and the whole schedule throughout the day to help the student maintain what he calls a charged visual battery throughout the school day. And he gives that analogy that, what do you do when your phone is out of batteries? It's about to die. You've got to plug it in. You got to charge it. Okay, and maybe it doesn't mean that you can't use it while it's being charged, but you're going to have to go back to the charging station. I like to use the analogy of a thermostat on your car. Okay, the thermostat on your car, when you're using it and using it and using it and using it, and if there's anything not working about that system, it can get pushed up towards the red, right, towards that red zone. Once it's in the red zone, if it stays there for too long, there will be a shutdown. There will be a meltdown, and then it's game over. The goal is to keep the student below that red zone, and we can only do that if it gets too hot and starts to get overheated. We've got to let it cool off. That's the only way. If we keep going and keep going, we're going to have a meltdown. He looks at this complexity of the framework. The What's the Complexity framework looks at the combination of the complexity of the environment and the task that you're presenting the student with. And there's a little chart that you can access through the PCVIS, Pediatric Cortical Visual Impairment Society website. And the link is on this page below, pcvis.vision. There's a little chart that he created which basically shows this kind of thermostat, thermometer kind of example. And we're looking at how do we understand how complex the environment is, the different factors that go into the environment being complex, and the task being complex. And how much can your student handle? How do you keep them in that comfortable zone as opposed to pushing into that burnout zone or having too low of demands and under adapting for your student and not challenging them enough. So that's a useful one to use for kids really in any phase, but I find it especially important in phase 2 and phase 3. In phase 2, the TVI, you might be doing a combination of push in and pull out sessions, right? And that's because you still want to do some, individual one-to-one work with students on certain tasks that you might want to pull them out for. But because the goal of phase 2 is to integrate vision and function and to learn how to use their vision throughout the day, you've got to do some degree of pushing into the classroom so that you can work with the classroom staff or with other related service providers to figure out how to use vision in their activities. Again, got some sample IEP goals in phase 2. I'm just giving these to you as examples or references. We don't need to look through them. There's also an example of long-term and short-term goals for AAC, for communication, that would be appropriate in phase 2. In the last 15 minutes or so, I'm just going to do a quick little overview of phase 3. We could spend an entire day just talking about phase 3 because it's so complex and there's so many different ideas and strategies and ways to look at this, but let's just get the solid foundation and overview of intervention and program development in phase 3. The goal in phase 3 is refinement of the CVI characteristics, which is sort of an abstract way of saying we're not totally resolving them, but we're trying to get sharper and sharper and sharper so that these characteristics aren't impacting the student as much throughout the day. Kids in phase 3 and a go-to kind of telltale sign that a student is in phase 3, demonstrate visual curiosity. That means that they use their vision to look around and explore what's around them. Students in phase 3 can process two-dimensional materials. That doesn't mean that they understand what they mean. So the goal in phase 3 really has to do with adding images to that Google image bank that we talked about before. We're adding images in and we're helping the student understand what it is that they're looking at. Okay, their visual vocabulary. One of the important ways to think about doing this is breaking down anything new that you're showing the student or anything that's hard for them to understand or to generalize into its salient visual features. You probably heard that phrase before if you've done any CVI training before. A salient feature is the unique or specific visual part of an object or a symbol or a thing that gives it unique meaning. It's a visual feature, not a functional feature, not a tactile or texture feature. It's a unique visual feature of something that makes it identifiable. So for example, on the lower center of the screen, you see these two line drawing symbols. These are like the Boardmaker PEX symbols that you often use in special ed environments for communication. They're just little cartoon faces. They look like little egg-shaped faces with a smiley face and with a frown, right? And those are the symbols for happy and sad. Now, the unique feature of this, how do we tell the difference between the two of those things? Really, the only thing that we can pick out is the shape of the mouth. So one thing we could think about doing is just outlining the shape of the mouth, right? The yellow and maybe with a distinct color. Yellow for happy, red for sad, and so on. Okay. If we're going to do that, we might also think about taking away the word, the sight word above there. If we're just focusing on the symbol, the word is just adding to the complexity. Or we could start to be able to substitute symbols like this for sight words, which themselves have a color outline or bubbling to be able to emphasize the shape of that word. Okay. Even before a student is reading sight words, if we're using abstract symbols with the student, a sight word is just as visually complex as an abstract symbol. Okay, so let's take a step back here for a second. Okay, and think about this salient feature instruction idea. What is that? I'm showing you a cartoon, and it's clearly a cartoon image of a duck. Okay, it's a yellow cartoon duck with an orange beak and orange feet. Does anybody want to take a stab at identifying what a salient feature of this duck might be? What would be a salient visual feature that you could pick out that would make this identifiable as a duck? How do you know this is a duck?
Maybe the webbed feet.
Good, maybe the webbed feet. That's pretty unique to a duck, right? Anything else that stands out visually?
The beak.
The beak. Yeah, the beak is a good one, definitely. Maybe also the shape from sort of like the base of the neck to the tail. There's this nice curved shape that's pretty identifiable as a duck. So when we think of salient features, we want to be thoughtful of, and nobody said the color yellow, right? Because we all know that ducks don't have to be yellow. So identifying it as yellow doesn't necessarily help us with identifying other ducks. So now I'm showing on the right side a photograph of a real duck, a mallard duck, in the water. And this is hard because a student with CVI, if they knew that the salient feature of a duck was the webbed feet, it's going to be hard to find the webbed feet now because the duck is in the water and we can't see its feet. We could still use the bill. The duck's bill would be a pretty good one. We could also maybe use that curve on the back, right? Which is, I don't know if that's totally unique to ducks, but it might help us. So when we pick out salient features, we want to think about our Google image bank and how kids with CVI can frequently confuse one thing for another. I'm showing you a photograph of a little puppy, a golden retriever, and below it a photograph of a grizzly bear, both in a green background, in a field or in the grass. A student with CVI might look at these two pictures and think that's the same thing, that's the same animal. Why? Because they both have that similar color, they've both got actually that similar snout, and they've both got those two front legs that we're looking at in those pictures. I actually saw a student with CVI recently who, when we showed him pictures of different animals, we showed him a kangaroo and he said that it was a T-Rex. And I thought that was fascinating because if you think about it, he was looking for that salient feature, and what he found was those two front legs and that kind of posture and that general shape, and he thought, oh, that's a T-Rex. I've seen pictures of T-Rex, of Tyrannosaurus Rex before, and that's what that is. And I have seen a student look at a picture of this bear down here and say dog, or different pictures of bears. So what we want to do in phase 3 is we want to figure out what are the ways that we can start to pick apart the unique salient features that make something identifiable. And we want to teach those things. So start with your Google image search and let's figure out a good representative picture of a bear. So, and why is that different from, your basic representative picture of a dog? So let's start with a picture. Got a photograph of a bear, sort of a front, pose of a bear looking right at you with the green background. We're going to get rid of the background. And let me just show you really quickly. Take that away for a second. Let me just show you really quickly. If you have PowerPoint, there's a very nice, easy way to do that. I'm just going to give you a very, very quick kind of hands-on tutorial. If you have PowerPoint, select a picture, a photograph, double-click on it, and you get this picture format option. On the top left, there's a little option that says remove background, and you'll see what it does. It creates this weird kind of magenta screen over the picture. That's not exactly what we wanted. So there's a little button on the top left that says mark areas to keep. And we're just going to draw a line. You don't have to be an artist to do this. We're going to draw a line over the areas that we want to keep. And we can kind of draw those out and make them, more precise. A little more of the ears right there. Right. Mark the areas to keep. Let's get that. And okay, that was pretty much what I wanted. And then you're going to click keep changes. And what it does is it takes that background away. And you could be more precise than this, right? But it's a very quick way to take the background away. There's another application, I think it's just a website called remove.bg, remove.bg, remove background. And that's another way that you can do this too. Okay, let's step backwards. Okay, and back to the presentation. Okay, and we've got just about 5 minutes before I'm going to turn it over to you guys. So pick your picture, take away the background, highlight the salient feature. What we're doing is we're pointing out to the student, what is a unique feature that makes this a bear and not a dog? Now, the one that I picked for the first one anyway, you could have a few, but the one I picked for the first one is this round shape of the ears on the top of the head, so that we can show the student this is a bear. We know it's a bear because it's got these round ears on the top of its head, these little round ears on the top of its head. And now let's look at other pictures of bears, photographs, black and white photographs, color photographs, line drawings, cartoons, and so on. And in each one, we're going to find that salient feature to be able to tell that's a bear. this is a cool example I'll show you. That's just there in the materials, just some resources and stuff for you. There's a website, the Salient Features Collaborative, and I'll just show you this really quickly because this is a pretty good one. This saves you, again, a lot of legwork, and the link is there in the PowerPoint. This is developed by Matt Tejan in the class that he teaches on complexity, and it's pretty creative. He got the students in the class each time that's taught, to pick an item that's not on this list yet, add it to the list, there's a lot of them, come up with what the salient features are, and then adapt it. So we've got a photograph of a cat with the background removed, we've got the whiskers outlined, we've got on a separate picture the ears outlined. We don't want to do them all on the same picture. And then on another picture, the tail. Okay, so that what we're doing here is we're asking a student, we're showing a student, this is a cat, and you can create a script for this. It has whiskers that come out in lines from the side of its face. It has pointy ears on the top of its head, and it's got this long tail. Now, the comparative language part of this, to teach this, is to say a cat is different from a dog, which has a snout shaped like this, and we're showing that little, curved shape of the snout, these 4 paws, and on straight long legs, and this pointy tail coming out the back. Now let's look at more pictures of cats. Can you find the long straight whiskers on the side of its face, the short pointy ears on top of its head, and the long tail? Now can you find it in a color photograph, maybe a color photograph in a different one, maybe also a black and white photograph, different cartoons of different levels of complexity, and then on the right side, finally, a pretty abstract 2D image. The same approach can be used for pointing out landmarks, signs, symbols, words, letters, and so on. You can create a salient feature dictionary of the words that the student is focusing on learning. And you see in phase 3, we're trying to fill that Google image bank by basically creating this whole inventory of images and symbols that we're teaching the student. And it's very easy to get carried away because it's hard to figure out what's the priority here. Does my student need to learn animals, or is there something more functional for them? What you're going to find is that you don't need to teach kids all of the 10,000 things in the world. You just need to prioritize what's important to them and teach them the skills that they need to start to discriminate between different things. Okay, so in the PowerPoint, I've got a couple more things for you. I just want to share this last resource before wrapping up. I talked about sight word bubbling, right? In order for teaching sight words to actually bubble or color outline around the word, there is also this great internet app called Roman word bubbling that was actually created by the parent of a child with CVI who also happens to be a programmer for Google. So that was handy. You can type a word in, you can increase the font, you can change the font, you can do a black background, you could change the color of the outline around the word, and you can also hide the text if you just want to look at the shape of the word and not the word itself. If you right click on it, you can save the image. So you can, upload this into your students' work or presentations and so on. There are lots of resources on how to actually do this. This is another one on the Pediatric Cortical Visual Impairment website, how you might actually teach these skills. Okay, there's some more here just of examples of, what to put on an IP and goal development and stuff like that, and lots more examples of adaptations. I want to just wrap it up. I'm going to share the PowerPoint with you. So as a PDF, you are more than welcome to reach out to me anytime. You have my email there on the screen. It's also on the PDF as well. And does anybody have questions? Anything you wanted to clarify before we wrap it up? We just have a couple more minutes left. And I'm going to put, before I stop sharing my screen, I'm going to put my email in the chat
Want to thank our presenters today, Chris Russell and Regina Quaid, for empowering us with knowledge and how we can apply this knowledge to better support students with disabilities. And students especially, specifically with cortical visual impairment. So show us our presenter some love and give him some shout outs in the chat.
Yay, thank you, thank you.
We want to thank our teachers, our service providers, administrators that care about students enough to join a full day of learning about cortical visual impairment. And unless anybody has anything else, I think that's all we have for today.
Did you say you were going to send the PowerPoint to Peggy and Ellen, and then they'll share it with us? Perfect. Thank you so
Perfect,
much.
I'll send it to you right now. And so
Great.
along with any of the resources that I shared, and anyone's welcome to reach out to me too. But thank you so much again for having me. Really enjoy spending the day with you, and I hope you all found something useful.
Great.
Very
Thanks
much
so much.
so. Thank you. And Regina, it's okay to share yours as well? I'll share Regina's.
Yes, that is fine. You can share mine also. Yes.
Thank you. All right, y'all, happy Friday. Have a great weekend.
Bye.